and welcome to this measurement strand of the Violence, Abuse and Mental Health Network introduction to the work that we've been doing over the past several years of the network that you're about to access in video form or via the website. I'm Dr. Jude Towers, based at Edge Hill University, and I've been a member of the measurement strand throughout the project. So we set up the measurement strand at the beginning of the project to think about measurement, the challenges, the opportunities, the measurement of the extent and the impact of domestic violence and sexual violence in relation to mental health. Now, we know measurement can be controversial, but we also know that it's really important to understand trends, to understand patterns, and to understand the impact of interventions. Now, those interventions might be significant social change like COVID, they might be legislative change, they might be changes in policy or practice. So on the measurement strand, we've been thinking about what can we measure, how do we measure, how can we improve the measurement of domestic and sexual violence in relation to mental health, and how can that help us move forward towards those ultimate goals around reducing and eliminating domestic and sexual violence in relation to mental health. So we've done several things over the years on the management strand. We started back in the summer of 2019 with a 2-day conference down in London, where we had academics, we had policymakers, we had practitioners, we had third sector organisations, we had government organisations, we had representatives from the Office for National Statistics, and we spent 2 days talking about what are the current opportunities and challenges around measuring domestic and sexual violence in relation to mental health. And that kicked off our work on the measurement strand. We also took that opportunity to launch the first set of research funding, the small grants that through the network have funded a series of research projects. So on the measurement strand, we funded 4 projects, and there's some videos around talking about from those people who undertook that research, what that involved, what that looked like. And you can also access the final reports on those research projects via the Violence, Abuse and Mental Health Network website. So we had projects that looked at looking at ways to measure and assess the long-term support needs of adults who had survived sexual assault and sexual violence. We had a project that looked to attempt to estimate the lifetime cost of sexual violence in one particular county, in the county of Essex. We had a project that looked at frameworks to measure the mental health harms from violence and abuse at different thresholds. And finally, we had a project that looked at measuring risk to children who were exposed to intimate partner violence between their adult parents, guardians, caregivers. And as I say, the final reports for those are now out. They're contributing to the knowledge base, they're creating debate and discussion, and they're taking us forward in the strand of measurement. Secondly, in this strand, we started by putting together a data directory. So we attempted to find all sources around data that would be useful to anyone who was looking at violence, sexual and domestic violence, and the impact of mental health. So we looked at published statistics, we looked at raw data that was available, we looked at data sets that had been put together that were available in the public domain, and we put all of these resources together in one place in our data directory, which you can access from the website. And once we started thinking about the data directory, what we realized was we needed a couple of other directories to help move that work forward. So sometimes data is very complicated, sometimes data is very difficult to access, Sometimes particular data sets take a long time to understand and get to the point where you can use them in a transparent and ethical manner. So we also launched 2 new directories, one around networks. So we were looking for people who were involved in networks that were relevant to domestic and sexual violence and mental health. This was to help people who wanted to undertake research or were looking for particular types of expertise that they could then call on to get involved in policy work, practice work, research work around domestic and sexual violence and mental health. And secondly, we launched an experts directory where we invited anyone working or living in any capacity, whether that was as an academic, as a practitioner, with lived or living experience, all of those expertise that people were willing to share. We opened them up to a directory and asked people to register themselves, again, so that when someone wanted a particular type of expertise in domestic and sexual violence in relation to mental health, they had that directory all together in one place that they could go and access. And alongside that, a little bit later on through the project, we also developed a blog directory where members of our league, our lived experience advisory group, also started to comment on and to reflect on how they'd been impacted by some of these challenges and opportunities. And to that end, we also have a video interview as part of this end of network event for the measurement strand with our league coordinator and one of our league members who specifically have been reflecting on the opportunities and challenges for measurement and how those with lived experience or living experience of domestic and sexual violence and mental health have found measurement, have reflected on measurement, and have had the opportunity to put into the public domain via this video interview some of the things that they think are missing, some of the opportunities that they think are available going ahead, and some of the challenges that have been particularly poignant to those who've got lived experience. So that's the measurement strand. I hope that you find the resources via the videos and the website really useful, really engaging, and really stimulating, and that as part of our aim for this network is that you engage with these resources as part of that push to eliminating, improving the lives of, improving the understanding of, developing better interventions for those who are subject to domestic and sexual violence and in relation to their mental health. Thank you.